Many new parents struggle after the birth of a child. It impacts how you feel, your identity, your relationship, and your sex life. 20% of new parents have postpartum anxiety or depression. That's a huge number. And this includes both biological and adoptive moms and dads. One of our listeners asked if I could speak about this topic, so I reached out to a colleague who specializes in postpartum anxiety and depression. Join us today as we unpack typical responses after a birth and explore how to know if we need help and then how to get it. Hi there, I'm your host, Dr. Heather England, an executive coach, psychotherapist, and relationship expert. Welcome to the Great Sex Podcast, where we dive deep into the world of relationships, whether that's your relationship with yourself, the people who matter most to you, or your relationship with your sexuality. I'm so excited about today's episode, so let's dive right in. I am so excited to have my colleague and friend, Michelle Tangeman, with me today to talk all about postpartum anxiety and depression and really what it's like after you have a baby in your home as a new mom. And I think this is an important topic, not just for women and not just for women who have just had babies, but women who might have daughters that have babies, but also for husbands too, so that they can really understand the experience, that their partner is going through. So let me give you a little information about Michelle. Michelle is a licensed marriage and family therapist. She's board certified behavioral analyst. She has a private practice in the Los Angeles area, and she owns a business called Thriving Toddler, which helps parents to really be better at parenting their toddlers and their young children. She's also the co-host of a podcast called Parenting Understood, which just hit over 50,000 downloads, which is really pretty awesome for a podcast. So kudos to you, Michelle. That's great. Michelle has expertise in postpartum anxiety, depression, and she is a parenting rock star. So I am so excited to have her here today. I think she's the perfect person to help us wade through this topic. So welcome, Michelle.
Oh, Heather, thank you so much for having us or having me. And thank you for that beautiful introduction.
Well, it's heartfelt. I have the highest of respect for you, not just as a therapist, but as a business person too. And
Oh,
as a
thank you,
mom,
Heather.
because I've seen the things
Oh,
you do to raise your children.
yeah. Yeah, it's quite the journey, isn't it? I know that you were there, right there with
Yes,
me.
it is quite the journey. And I think this is such an important topic because, gosh, we have babies and everything changes in our life, and
Mhm.
for the good, it's really exciting. But things impact our relationship, not always in positive ways. We're tired.
Mhm.
Our bodies don't feel right at first. We've got this new human that relies on us 100%, and our hormones are all over the place. So it's really quite a period of adjustment for people. And some people can get through it pretty smoothly, and some people have more of a challenge with it.
Absolutely. Absolutely. And I think that nothing can really, really prepare you. I think most women have an idea or they have an ideology that they're kind of holding on to, but nothing truly prepares you for the monumental change ahead and until you're there, until you're living it, until you're in the moment. And then you're like, okay, so this is where I'm at. What do I do with all of these feelings and the rapid change in hormones? And that can be really challenging. And all the women I see in my private practice that I'm supporting through most postpartum mood, we're talking about these common topics that come up for most women.
Right, right. So I think it's really important to talk about what is pretty typical that happens after
Yeah,
people have a baby, how they
yeah,
feel, what happens inside their body, how they feel
yeah.
about their partner, what happens to their sexual desire. And then, how do you know you need help? right? How do you know
Yeah,
you're really
yeah.
getting into this danger zone of depression or anxiety?
Yeah, and of course, I always want to start with, we have these general class of symptoms, right, that you can experience, but they vary from person to person. So,
Mm-hmm.
early in the postpartum years, moms and people have heard about the baby blues, and the baby blues are very common. And then the symptoms are very similar, if not exactly the same, as postpartum depression.
Mm-hmm.
And really, the clearest difference is duration of symptoms. And so,
Mm.
baby blues, you can have the sad mood, maybe the irritability. Of course, most moms are trying to figure out breastfeeding, or they've decided they're not going to. Um, they may have experienced tremendous guilt, excessive worry, and fear.
Mm-hmm.
Social withdrawal naturally because you have to be
Mm.
home with the baby due to maybe vaccines or illnesses or whatever it may be. And so there's just natural isolation,
Yeah.
changes in appetite and sleep. And so those are true for and universal for most women.
Mm-hmm.
But the difference between the blues and actual having a diagnosis is the persistence, the impairment on your life, and what
Mm.
it prevents you from doing, and the duration of your symptoms. So
Mm.
the postpartum period really starts at conception from a medical model,
Huh.
conception to 1 year of life. And I know that, in this
Wow.
world, people professionals would even argue up until age 6. Like I've spoken to midwives and lactation consultants, and in my discussions with them, beyond the medical model and their experience, they're saying like really this whole postpartum period really you kind of come out of it when your kids are much more independent. And that makes sense from a developmental perspective. Your kids are
Uh-huh.
6 and they're kind of doing a lot more. They have a lot of skills. But up until then, they're heavily dependent on their caregivers.
Right. And gosh, that could be a really long period, especially if you have multiple children.
Right, right, right. Absolutely.
Yeah.
Absolutely. But I think the biggest thing to think about is in terms of the hormonal changes.
Mm-hmm.
I think I think I read this on Postpartum Support International, which is a really great resource for um, anybody supporting a postpartum mom. There's tons and tons and tons of supports and information on that website. But I had read it's one of the only times in human history where there will be an excessive amount of hormonal fluctuation. And
Mm.
so that's what's happening right after you deliver your baby and
Mm-hmm.
for this period of time. And so it's really paying close attention. I want to talk just kind of briefly about risk factors because I think that's something you can kind of prepare for as a mom if you're currently pregnant or expecting. Um, and I think taking a look at your personal and family history, having those conversations with
Mm-hmm.
family members. What was it like for you?
Hmm.
Maybe they didn't know it was called postpartum depression or anxiety at that time, but maybe they had a lot of those symptoms.
Yeah, but what a great
Excuse-
idea, because most people wouldn't think to ask those questions.
Yeah, I mean, you want to think of it as a happy, joyful time, and it is.
Right.
Absolutely, it is. But for those moms that maybe want to prepare a little bit more, and you're like, I
Mm-hmm.
am kind of concerned about this, I'm thinking about it more, having those conversations, especially with the women in your family, I think are really important.
Yeah.
Also, equally important, having those conversations with the men in terms of their involvement during that time as well.
Yeah, exactly. Huh.
Risk factor also includes lack of support. So kind of thinking about what does support look like for you in those early postpartum days,
Yeah.
weeks, and months. Um,
Yeah, and that can be
women that have.
sorry, that can be so hard. I remember we moved out to Kansas City and I had my first child and we had no family in the area. And like we
Mhm,
literally moved here and I had a baby 3 weeks later. So I didn't
mhm.
know anybody. When I would go to the grocery store, I think I would talk the cashier's head off because I was just craving some kind of connection with somebody. And I felt so isolated and it was just such a difficult time. And I just felt I was
Yeah.
always alone with this child that just cried all the time, all the time.
Yeah. Right. And I think the most concerning part in this period is that you think it's never going to get better because
Mhm.
in your mind, you have no idea what to expect. This is especially if you're a new mom.
Mhm.
Um, you have no idea, like, when is it going to change? When is this going to get better? Like,
Right.
where's the light at the end of the tunnel? And that can really exacerbate your symptoms.
Yeah, and I think,
Um,
breastfeeding is can be really hard for a lot of people. And
mhm,
I know I struggled with breastfeeding and I got no support from my mom at the time because that wasn't what she did in her generation.
mhm.
And so she kept telling me, oh, just do formula. But it was so hard to get the baby to breastfeed. And I didn't even know where to go for help. It was just
Yeah,
it was a hard time.
yeah. I mean, and the support that they have today, there's a lot more support. I also struggled with breastfeeding, and I think I would say 90% of the women that I see struggle with breastfeeding.
Hmm. Wow,
And
that's a
because
big
I think
percentage.
yeah, and I think what I often hear from them is that I feel like it should come naturally. This is what my body was made to do.
Yes.
Why am I failing at this?
Yes.
Why is this so hard? Like, don't they just know how to do it? And I think those thoughts often come up, and then the guilt settles in that it's
Oh,
just not going as planned and something is
totally.
wrong with
And
me. I am defective.
yes, what's wrong with me? I'm defective. What am I just going to be a bad mother? Yeah, exactly. And every image we see of young mothers, it's beautiful. It's idealized. And so when you're in that place and it's hard, you do. You
Mm-hmm.
think, why can't I do this? What's wrong with me? And that's a
Mm-hmm.
hard place
And
to
then,
be, especially when your
a-
hormones are going all over the place.
right. And especially if you are determined, right? Like determination is a beautiful thing, right? Because it's going to help you problem solve. You're going to come up with different solutions. But at a certain point, I tell moms, like, if it is impeding on your ability to function and it becomes all consuming, it's time to just consider. Don't make a decision. It's time to consider alternatives,
Yeah.
knowing that you gave it your all. I saw a mom who she delivered her baby. She had hypertension, needed to
Mm.
have surgery. And so she was separated from her baby.
Mm.
And then there because of her health and her condition, she was separated for about a week.
Oh my
And so the
goodness.
baby was fed by dad
Right.
through, the bottle. And it's this
Mhm.
beautiful bonding experience between child and dad, which is wonderful. But what made it challenging is they missed all that time, and
Yeah.
having her come back to it was really challenging, but she was determined. And she tried and tried and tried for months. And eventually it was like, I have to accept that this is not going to happen for me
Mm.
with this baby. And I have to be okay with that for my mental health.
Wow. Good
And
for her
that's
that
where you want to make that decision. And that's a hard decision to get
yeah.
to. And she
Yeah.
needed that with the support of her team. She was fortunate enough to have a team supporting her to help her get to that point.
Mm. All right, so we said risk factors, family
Yep.
history, lack of support.
So for women that were taking medication, when they stopped taking medication, that's obviously a risk factor.
Mm.
History of domestic violence and
Mhm.
abuse is a risk factor. And then history of pregnancy loss. So those
Ah,
are the risk factors to look for that might contribute or increase the likelihood that you may experience a postpartum mood disorder.
okay. Well, okay, that's great. I love how you line that out. So let's look at, you gave information on what to look for that takes you
Mhm.
from what's typical to what then could be a problem. Okay,
Mhm.
so you said duration. So,
Duration. Yep. So, like, beyond that 2 weeks, if you're experiencing the sad mood, the irritability, lack of joy and pleasure, not looking forward to the future, feeling extensive amount of guilt over everything, excessive worry and fear, social withdrawal, and appetite and sleep disturbances are the major ones. So if
okay.
you're experiencing that for long periods of time, your mental health is certainly going to take a hit, and it's time to get additional support.
Okay, so 2 weeks.
Yep.
Wow. So
I know it's
how
not a lot of time.
No, it's not. That's what I'm sitting here thinking. And I'm thinking how many women actually are diagnosed versus how many women probably have postpartum anxiety or depression and just don't know.
So, according to Postpartum Support International, 1 in 5 moms experiences a PMAD. A PMAD is
Wow.
any kind of postpartum or even perinatal period, you can experience these symptoms of depression and anxiety. So, 1 in 5 moms. That's 1 in 5 moms and 1 in 10 dads. And the biggest risk factor for dads is if the mom is experiencing postpartum mood.
Well, I love that you brought up that this can impact fathers too.
Correct. And it's not just parents that give birth to children. These are also parents that have adopted babies.
Mm-hmm.
So that is also factored in. Those numbers are factored in there.
That's a lot of people.
It's a lot of people.
So how many people actually get help of that 20%?
Yeah.
How many
Yeah,
realize they have a problem?
that's a
Probably,
great question.
yeah.
And I don't know the actual numbers to that. I'm sure the numbers are out there somewhere. But I think the biggest reason is that moms don't get help is that they think that it's eventually it's just them. Like
Hmm.
it's gonna eventually go away, but it never really does. It just kind of gets worse.
Mm. So what happens when it gets worse?
When you really start to see impairment in your life, meaning where you're further into social withdrawal, right? So,
Mm.
like, you get to a point where maybe your child has had or your baby has had their first vaccine and you can venture out. That's typically around the 2 month mark in the United States. Um, and so they've had their first vaccine, it's time to venture out. Or maybe you run on the anxious side and you're not willing to relinquish the baby, meaning like
Hmm.
pass the baby off to a loving mother-in-law, mother, husband. Um, I find that that's probably the biggest symptom or like red flag that I'm looking for is if you are kind of this idea of gatekeeping. I am in control of everything and I cannot relinquish that control. Therefore, I can't get enough sleep. I cannot socialize. I cannot do these things that creates that what we call impairment. And when there's impairment, then that is a problem.
So if I'm a mother or a mother-in-law or even a partner, and I think that my family member, my loved one, is suffering
Mhm.
from this, I'm sitting here thinking, how do I broach this in the
Mhm.
kindest way that's going to be the most encouraging way for them to get help? I would think
Yeah.
validating would be really, really important in that process because I have to think that many of these people are filled with almost shame,
Mhm.
right?
Yeah,
And
absolutely. Talking about how difficult it is,
mhm,
providing supportive statements, validating their experience, letting them know they're not alone, like kind of being inquisitive and being curious. And do you want to go, take a nap? I'm happy to, sit on the floor with the baby.
mhm,
Um, does that sound appealing to you rather than, sometimes depending on family and culture and context, it's go take, like, you should be sleeping. And like right off the bat, when that statement comes out, like that should statement, then that's not going to go over very well.
mhm.
That's not going to be well received. It's saying, you seem tired. Are you tired? Can I help you? And sometimes not even like taking the open-ended question route is hard because the mom doesn't know what she needs. And so
Yeah.
just saying, I am here. Can I take the baby for you? Can I wash your dishes for you?
Mhm.
Can I make that meal for you?
I love that idea because so often when we want to help, if we ask the person how we can help them, One, like you
Hmm.
said, they don't often know, but it puts a burden on them to tell
Hmm.
you what they need and to like figure that out. But then they're asking you then to do something for them. And for many people, that's really difficult to do. And I've often
Absolutely.
heard even in times of sickness or grief, the best thing to do is really just to do something and just say,
Yeah.
"Hey, I want to help you. I'd love to do your laundry. I made you a meal.
Yeah.
I want to
Yeah.
watch your other children. Can I take them out to the park?"
Right. Absolutely. Providing those options goes a really long way. This example is not necessarily related to um, postpartum mood, but we were traveling as a family in the woods, and like it's very remote, and we've got three little kids. I've got a 3-year-old, 6-year-old. My sister-in-law's got a 3-year-old. Um, and her son was having a hard time adjusting. And he was having just a lot of like typical 3-year-old tantrums and getting up several times a night. And it was just her mom, his mom coming in and doing all of the support because
Mm,
it's mom, 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 mom. And the 3-year-old doesn't want anybody else but his mom. But after
typical
day 3 of
3-year-old.
this, right, typical 3-year-old. But after 3 days of this persistent behavior and constantly getting up and interrupting the sleep, what does that do to
Right.
that caregiver? It just
Yeah.
completely depletes them. Her
Right.
back was riddled with knots. She wasn't sleeping, but
Mm,
she's like doing an excellent job. And I just said, you know what? She was trying to sleep. Everybody's trying to sleep. Her son is up. He's tantruming because all he wants to do is be with mommy. And I said, you know what? I'm going to get up. I don't need to sleep. I feel rested. I know she needs to sleep. I'm going to take him and I am going to go walk with him in the woods. And so that's just an example of saying, like, if you're a support person, just stepping in and saying, I will take care of this. Right. But the mom has to be willing to accept it. And that's the hardest part sometimes is saying,
yeah.
like, okay, I will accept the help because I am the mom. I have to take care of it. It's me, me, me.
Mhm.
Some women are better about letting go, others are not. But if you find yourself in this kind of depressed mood or anxious mood, then it's saying, where can I get more support? Where can I kind of let go here? And sometimes that's a very gradual process, and that's
Mm.
okay.
So then how does someone know if they then need to seek counseling? Like if they need even further support than what their friends and family can do for them?
Right. So if your friends and family have intervened and it still doesn't feel like it's getting any better, then it's
Mhm.
probably time to seek the help of a professional and kind of look very closely at the thoughts that are coming up
Mm.
for you and that
Mm.
person, um, or
Mm.
that person that's experiencing the mood disturbance. So usually there's a lot of information in our thoughts, right? Because our thoughts
Right.
impact our feelings, impact our behavior. And so that's where you have a safe space to kind of explore and talk about what are the small steps I can take. And then usually with psychotherapy and intervention, there's two primary approaches that are treatment of choice, and that's cognitive behavioral therapy and interpersonal therapy. I like to do CBT. I know you do too. Um, but with that approach, usually I see symptom reduction with mild to moderate. When we're talking about severe depression, then usually it's so severe it needs kind of inpatient, like outpatient support that's individual group multiple times a week. But with mild to moderate symptoms, usually I see symptom reduction anywhere between session 6 and session 8.
Wow, that's
So
wonderful. Yeah.
it's really, really, it's really helpful to kind of step back, take a big picture. Where can we fill in the gaps? And then what are the thoughts that are coming up for
Mhm.
you during this period in your life?
So could you give an example of what might be a thought that is causing problems and then how you would use CBT to challenge the thought and replace it?
Yeah, absolutely. So let's use this breastfeeding example. I should be able to breastfeed comes up very often.
Mhm.
And so it's working through this idea of, okay, what's the thought that comes up? Okay. And can you pinpoint the thought that's really driving the emotion from you, that's maybe bringing tears to your face? And then can you kind of give it a number? How severe does that symptom feel for you, or that feeling feel for you? Is it 100%? Is it more like a 50%? Is it 20% in that particular context? Context is very important. And then moving beyond that, it's talking about, okay, so what are some alternative thoughts that will challenge that you should be able to breastfeed? Well, breastfeeding doesn't necessarily come easy, actually, per the data, and that depending on the child's mouth, right, and their
Mm-hmm.
tongue, could something be going on with that? The latch, there are so many variables and factors to consider. Was the baby premature? That could play
Mm-hmm.
into it. So what are some alternative, realistic ideas that are coming up? And whatever lands for them, usually I have the client take a stab at it first,
Mm-hmm.
right? And then if that doesn't go well, needs a little bit of guidance. And I say, what about this? What about this? With the examples I just gave. And then the mom will be like, okay, yes, not so much for me. And then we put the two statements together, that I should be able to breastfeed. I feel like I need to be able to breastfeed, but, and then talk about these alternative ideas. And then we rate the emotion again. What emotion is coming up for you, or what feeling is coming up for you? And about what percentage now after we've gone through this exercise. And that exercise alone, doing it over and over and over again, really helps in bringing down the mood,
Yeah.
or bringing up the mood, actually, I should
Right.
say, like, you're
Changing the
feeling
feeling,
better.
changing the
Correct.
feeling. Right. Well, and
Correct.
that makes sense because it took a while for them to feel this way and to get those thoughts
Yeah.
ingrained. So it's going to
Right.
take a little while to undo that. So I know we're running out of time and I need to get us wrapped up here. Um, I just have one last question. So, if
Mhm.
somebody really is sitting here listening to this and thinking, I need help, or I have a loved one that needs help, how do they find a therapist that is competent to
Yeah.
do this type of work? Because I
Yeah.
don't think every
Yeah.
therapist knows how to do this.
Sure, absolutely. I think, and I mentioned before, there are two primary, clinicians would say treatment of choice. You want to find a therapist that is, skilled at cognitive behavioral therapy. They actually now, Postpartum Support International actually provides a 2-day intensive training where you can
Wow.
get extra certification. It's called a PMH-C. And so if you find a therapist that also has those letters, it says they've taken the exam, they've taken the training, they've taken the exam, and they specialize in that type of psychotherapy. So that's a great indicator. Somebody like me, I've taken the training. I didn't take the time to take the exam. So I
Hmm.
have the training. I'm
Right.
competent in delivering the therapy. Um, but
So
you
I
can also go
imagine
to,
if they read an about page on a therapist or just read their bio, their
yeah,
profile,
yeah,
it's going to call
hmm
out their expertise in that area.
right.
And I'm hearing you say, make sure they've been trained, make sure they've gotten some
Yeah,
kind of
make sure
training,
they've absolutely,
not just read a book.
absolutely. Right,
Right.
right. Absolutely. Get that extra training is really helpful. And there is a directory of clinicians that have gone through the training or have the credential at Postpartum Support International. There are also lots of other resources. That's just kind of my go-to. And then for, loved ones that are supporting a new mom, there's a great book called Beyond Blues, Understanding and Treating Perinatal and Postpartum Depression and Anxiety. This is great for clinicians, but it's also just great for anybody that's supporting um, a postpartum parent. So I also recommend that book.
Oh, that's fabulous. Well, I'm going to put in the show notes links to all of the references that you mentioned, the book, Postpartum Support International, I'll include links to find Michelle, to Thriving Toddler, because that is a great resource to check out. And I'd also encourage you to listen to her podcast. So I will include a link to your podcast. I so appreciate you doing this today, Michelle. I said in the intro, which you didn't get to hear me say this because I recorded it before we got together, but I actually had a listener ask for us to talk
Hmm.
about this subject, and I just think it's so important because we don't want to
Hmm.
minimize ourselves for just having baby blues because it's real.
Hmm. It is real. It
Yeah.
really is. 1 in 5 moms. Remember that.
1 in 5, that's a
1 in 5
huge
moms.
number. Wow. So
It's a
if you're
huge
one of those
number.
1 in 5, please don't feel like you're alone. You're in really good
Hmm.
company. So
Hmm.
thanks again, Michelle. I really appreciate it. It was great having you on as a guest.
Thank you, Heather, for having me.
All right. Bye.
Bye.
Thanks for joining us today. If you know someone who would benefit from today's episode, please share it with them. And until next time, my wish for you is to create opportunities to nurture your self esteem and your love and friendship with your partner, along with adding an extra spark to your sex life. I'll see you next week. Take care.